You're listening to the Full and Thriving Podcast, a place where courageous women come to break free from food obsession, heal their relationship with their body, and strive to live a life that's present, lighthearted, and meaningful. If you're listening, my wish is that this podcast serves as a catalyst that inspires you to nourish your body, nurture your mind, and energize your spirit. I'm your host, Meg McCabe, a certified life coach and eating disorder recovery coach with a PhD in having a good time. Just kidding about that last part. Anyway, thank you so much for listening and enjoy the show. Hello, lovely friends. Before we begin this episode of the show, I wanted to officially announce that the doors to the Recovery Collective are open today through February 1st. If you're interested in becoming a member and joining my private recovery community for online workshops, guest speakers, group coaching, and annual retreats, now is your time to join. This offer won't happen again until the summer. So please head on over to recoverycollective.mykajabi.com or use the link in the show notes to become a member today. Who knows, maybe your future best friend is waiting for you inside.
My favorite part about the Recovery Collective is that as of joining about a year ago, I finally realized how important it is to have a community in recovery.
It was definitely a turning point for me to finally talk to someone who's understanding.
The people in the Recovery Collective are some of the most lovely, supportive people I've ever met.
If you're thinking about joining the Recovery Collective, I have 2 words to say to you. Do it. Literally just give it a chance. I think you will be surprised in the most wonderful way.
Make the jump and join. It's honestly one of the best things I ever did, and I've made some of my best friends from around the world.
It's a safe place for me. I know I can say anything and never get judged for it. And I feel that we all truly care about each other.
Well, there you have it. Our members have spoken. And I might be a little biased, but I think our community is pretty great too. Have you heard about the use of ketamine-assisted psychotherapy in recovery spaces, but are unsure what it is and how it can be safely used in treatment? Are you curious if ketamine-assisted psychotherapy is right for you during your recovery journey? In this episode, I sit down with Alyson Inez Ford, an eating disorder and OCD therapist who practices through a health at every size and social justice lens. In her practice, she offers ketamine-assisted psychotherapy as a complement to therapy to help eligible patients experience more frequent breakthroughs and sustained improvement in symptoms. If you want to learn more about ketamine-assisted psychotherapy for eating disorders, this is the episode for you. Hi, Alyson. Welcome to the show.
Hey, thanks for having me on today.
I'm so grateful to have you here. It is always exciting to meet a new face, and I appreciate you taking the time, especially so close to the holidays, to hopping on this interview.
Of course. I'm excited to chat with you.
Awesome. So I know we have our big topic today, which is talking all about ketamine-assisted therapy, which I'm so curious about. I know our listeners are too. But before we dive into that, I would love to learn more about you and your background. What led you to becoming an eating disorder and OCD therapist?
Yeah, I love this question because it really is so tied to, I guess, like my sense of purpose and mission in life, one of them. And it really comes through personal experience. I experienced a significant amount of trauma in my childhood and developed an eating disorder from there, as well as body dysmorphic disorder, and had OCD kind of throughout, but didn't know that it was OCD. But honestly, some of my first memories in life are OCD memories, which is really sad, but that's how long-term that's been. And I really didn't believe that any level of healing was for me. I just didn't have a lot of hope. And so when I finally found a place of stability and recovery, I really wanted to pay it forward and help be a part of other people's journeys and at least provide the hope that change is absolutely possible. It's super hard. It's super scary. There's a lot of barriers, but it is possible. And I just love being part of people's journey into that as well.
I love that. I'm really curious, what made you feel hopeless from the start? It's such a deep question to kick off with. Like, what made you feel that way from the get-go? Was it just feeling everything so deeply entrenched? And, I'm curious about that.
Yeah, good question. I haven't really reflected on that a ton, but when I think about it, I think it's really just, I felt so trapped. I felt so trapped in like my mindset, my behaviors, my circumstances that also like made me sort of need the eating disorder as this way to cope. But I think the biggest barrier really felt, outside of the obvious ones, like accessing appropriate treatment and stuff like that. I think I just felt so trapped in it. I felt like even though like maybe there was somewhat of an idea of what I had to do to move forward, it felt like I couldn't do it. It felt like I was just like sort of in quicksand. I feel like that's how trapped both an eating disorder and an OCD can really make you feel.
I feel like both of them feed into each other so much that it is a super difficult layer to the eating disorder mix to have an OCD diagnosis as well. So I could only imagine how challenging that was for you. And so what was the thing that helped you feel a little bit more hopeful so that you could eventually recover?
Yeah, there was a couple things. I think first was my dog, Delta, who actually passed away this year, but I got her like a couple years into recovery and she made me want to live. It was something I had to take care of that, wasn't myself. And she was so compassionate and gentle with me. Like, it sounds maybe silly to some people that aren't dog lovers, but she taught me what love was like. And I feel like that love helped me be a little kinder and more gentle to myself. And then eventually finding a therapist that I just like really clicked with. That was so key and gave me so much hope and really was a big turning point in my recovery.
Wow. Both such beautiful instances. I could talk to you all day about the power of animals and dogs. They are such good examples of unconditional love and support. And that just makes me want to cry almost thinking about how your dog could give you hope. And I think, I have a community with the Recovery Collective and we talk about our animals all the time because it's just a big part of healing for so many. So thank you for sharing a little bit about your story. I really appreciate that. So how did you discover ketamine and what made you feel called to bring it into your practice?
Yeah, it's a really funny story because I definitely didn't go like a traditional route. But a few years ago, I had a client who was interested in working with me ask me if I would do sessions with them when they were at their doctor's office getting ketamine treatments. And this really interested me because I've always been kind of interested in psychedelic therapy. I've definitely personally experienced psychedelics and know how healing they can be. And at the time this client asked me, it was kind of when psychedelics were becoming more mainstream topic within psychology. So I looked into the logistics of it, made sure that I can. And one of, I guess, the benefits of before it being so mainstream was there wasn't these set guidelines of you have to do X, Y, and Z before you can work with ketamine assisted therapy. So I just kind of dove headfirst into it. I was like, sure, let's do this. We got all the legal and logistical stuff squared away and just started using some therapy modalities that have just worked really well with it, like IFS, narrative therapy. I have a really relational approach. And so bringing that to the space, it just complemented the ketamine so well. And because ketamine kind of leaves you in this opened state of consciousness. And so modalities that IFS that can be more metaphorical go really well with it. And so from seeing that client grow so much from a whole lot of different struggles, including really chronic PTSD kind of stuff, eating disorder, OCD, lots of things, that gave me a lot of interest into okay, how could I utilize this with more of my clients? and like really incorporate it into my practice. So I started expanding from there. And then I've since then taken like certification courses and things like that, and have like at least a third of my caseload on ketamine.
Wow, that is really fascinating. I love how sometimes the newest passion finds you, like it was when you were just doing your practice and someone came to you with this question and it opened up your life in so many ways and your practice in a new way. So that's really interesting to hear. And for the people who are totally not sure what ketamine is, could you explain to us in a very basic way what ketamine is and also what it has the power to do?
Yeah, absolutely. So ketamine is an anesthetic drug. It was synthesized in a lab in the 70s. And a lot of people know it as like a party drug or the horse tranquilizer, which it definitely has been used as both those things. But at the dosage that it's given to you in a therapeutic setting, it's a really low dose. And basically what they found is that at these lower doses, it has a mild psychedelic effect, and it works on different receptors in the brain that, for example, SSRIs, kind of traditional antidepressants, don't work on, that also impact depression and anxiety. So it acts as this, it's really cool, like a rapid acting antidepressant. So literally in like the ER, people that come in with suicidal ideation, they're sometimes given ketamine infusions and like immediately feel relief. So it's really helpful for like chronic cases of depression and anxiety where traditional medications just haven't been helpful. And in terms of what it has the power to do, there's so many things. I think on the personal level, like I said, it really opens your mind up to this like expanded state of consciousness. It helps you really sort of think beyond these maybe typical self-limiting beliefs or internal narratives that we've all been conditioned to carry. It helps us feel more connected to ourselves and each other, also like just the world around us. So it's pretty powerful. I think like our world would be a lot more like liberatory based if more people had exposure to like psychedelic treatments, because it really does have this kind of universal effect of like oneness, which in terms of like mental health conditions, if you think about like loneliness and being in solitude and hyper individualistic culture we live in, like to feel more connected to yourself and others is huge.
It does sound really powerful, like very amazing. I love that. As far as the experience itself goes, like when you are taking ketamine in its various forms and you're feeling that way, what is that like? I assume you've tried it. So what is it like when you're using ketamine for therapeutic purposes?
Yeah, so it's a very like pleasurable body experience for a lot of people. People that have never felt safe in their bodies report feeling like a sense of ease and comfort. It can make you feel a little silly, a little goosey, a little sleepy, like lowered anxiety, feeling more maybe positive. It's hard to put into words. But I guess if anyone listening has ever like used like cannabis or things like that, like there's some similarities, but also differences. I guess that's the best way I can describe it. But it's just this feeling of like openness and peace and just like pleasure.
Okay. So when you're in that state of openness, I assume that's when the therapy becomes really important. So as a therapist, are you giving therapeutic sessions while they are actually taking the drug, or is it after?
Yeah, so it's both. So
Okay.
We'll do sessions while a person is actually taking the medicine. And then we have follow-up integration sessions where we'll like process, okay, what was that like? These are some of the themes you talked about. Like, how do we kind of weave that into your everyday life? Because actually it's interesting, like the most powerful part of ketamine healing is actually the days following the actual treatment because of how it starts to change the brain. But certainly during the dosing session is really powerful as well.
Okay. So that's really helpful to know, especially the piece after the fact. How does the brain change? Like if we were to take it to a more scientific level, what's going on that is helpful for healing depression, anxiety, etc.?
Yeah. I mean, there's a lot going on, but basically, like, your ability for your brain to create more neural pathways, increase neural structures, it's like increased exponentially. So I always kind of explain it like ketamine's kind of like soil to a garden in terms of how it helps the brain. It kind of just fosters connection and new neural pathways. So the days after you receive ketamine, for example, are a really good time to practice doing like a fear food or do some kind of work towards some goal you have in recovery, because again, like it's going to take less repetition for your brain to sort of create this new neural pathway, helping you basically speed that up.
That's amazing. And I really love the connection to soil there.
Yeah.
Because you think about the variety, and I'm not a gardener, but I'm going to go into this anyway. You think about the variety of soil out there, and there's some soil that's like impossible to farm on. And then there's some really like fertile soil out there that can grow almost anything. So I'm imagining like ketamine turning kind of soil that's not able to grow very much to soil that can really grow an entire garden. So I love that metaphor.
Yes, it's like miracle grow for, for your brain.
I love that. So you're mentioning a little bit about ketamine and eating disorders. How do you usually use ketamine to facilitate and help eating disorder recovery? I know you mentioned it's really helpful for challenging fear foods. You don't have to do as much repetition. That sounds amazing. Anything else that you have leveraged it for?
Totally. That is like, honestly, not the primary thing I would say that I use it with clients. Like we're not doing ketamine sessions and doing a food exposure, but I think the things that facilitate maybe some of those changes in behavior are, really helping reduce the rigid thinking patterns that happen with eating disorders, and also these rigid patterns we have with just behaviors and how we live our day-to-day. Ketamine really breaks that and helps you see beyond that. It increases people's like mood and increases the feeling of hope. Kind of coming back to what I was saying in the beginning, like feeling so hopeless is such a barrier to recovery. And like understandably so, because it can be a really hopeless situation. And when you think of like the systems of care we operate in and just the lack of like quality providers and all the things, right? It can feel really hopeless. And how surrounded we are with like diet culture and other systems that like that. It really helps to increase your insight in a quicker time. Some people will say it's like, it feels like multiple therapy sessions in one. So it can help you build that hope, build motivation, feel a sense of connectedness to yourself and body, which is like huge for people in eating disorder recovery to have even just an hour where they feel ease and where they feel like, okay, there's a different relationship with my body that's possible. And then the other thing is, so many eating disorder sufferers have GI pain, GI discomfort, and ketamine does act on pain receptors as well. So my clients with like chronic GI conditions will also report like they feel like their GI symptoms are reduced for a bit. They can eat a meal easier. So there's just so many different effects.
That's really positive overall. It sounds like. Do you have any examples of a patient of yours with an eating disorder who was able to fully recover or reach a better place of healing through ketamine?
Oh my gosh, yes. So actually, I would love to read you some quotes that I have from different people who've done ketamine, both patients of myself and just like in the community.
Yay.
Yeah. I am a big believer in like just speaking from lived experience and uplifting people, just various perspectives. Okay. So here's a few. It helped me break through my barriers my mind was putting up in therapy. It's helped my mood, energy, and focus. It calmed my mind and body enough to give me huge but obvious insights I was missing. I was able to lift the dark clouds myself now instead of waiting for them to lift on their own. I went from debilitating depression to feeling like I can breathe again. Seeing a different perspective without judgment allowed me to tap into my true self and finally begin healing my trauma while minimizing flashback duration and frequency. Provided me an ounce of hope that life could get better, which was enough to keep me alive and to initiate eating disorder recovery. And last one, I've developed deeper self-awareness that has spread to all parts of my life by inserting compassion into my inner monologue and treatment of others. So I feel like that really speaks for itself.
It totally does. It sounds really helpful. Are there any, and I'm just curious now because it sounds really magical, awesome. Are there any downsides to ketamine, or are there people who should stay away from ketamine? Like, are there any warnings? I know that psychedelics have a lot of stigma there. So I just want to make sure that we can present a little bit of both sides.
Yeah, absolutely. So number one, someone with a history or family history of psychosis, so like psychotic episodes, schizophrenia, or bipolar with schizophrenic features. Typically, patients with those experiences are not good candidates for ketamine because ketamine can increase those symptoms. And then also people who have, I think this is something that I don't hear talked about enough, but when someone has trauma that's linked to substances, I feel like that really needs to be screened for and addressed, because also considering that ketamine has been used as like a date rape drug, I'm really mindful of just like people who've experienced sexual assault in general. Maybe ketamine wasn't part of the assault, but when they hear that word and they associate it with how it's been used in the past and then being a survivor, I just feel like it's important to really work through that if someone is interested in ketamine treatment and has a sexual assault survivor history, as well as communities that have, been criminalized for drug use, like BIPOC communities. It's super important to kind of address how that intergenerational trauma might be showing up in the experience of using drugs, because unfortunately, someone who's white versus someone who is Black or brown using a drug has a lot more stigma. So yes, there's absolutely multiple considerations and things that would indicate maybe it's not the best fit, and or maybe the person needs a lot of preparatory work before using the actual substance.
Those are such good points to just bring up and to consider if you hold any of those identities or like risk factors, because I think this is still a very new modality, right? And I would advise people to always proceed with caution and collect as much information and learn about the substance before you decide what's best for you.
Totally. Yeah. As much as I think it's wonderful and amazing, I don't think it's a cure-all, and I don't think it's for everyone.
Yeah. I think that's really helpful to get across, as far as like, it can be really powerful, but it's not going to resolve everything. It's just another tool or a resource to help you reach a place of healing.
Yeah. It is not something that you just take and then you have no eating disorder. It is, like you said, it's just a tool for some people.
Do people ever build like a dependence on it? Like, how do you get people to move away from the ketamine assisted therapy? Like, I assume people feel like they need it for some relief. How do you handle that?
Yeah, so it hasn't been an issue so far. Not saying that it wouldn't be an issue, but ketamine doesn't have like dependence effects like something like an opiate or a benzodiazepine. And the person is closely monitored by their doctor and psychiatrist to make sure they have the dose that's like safe for them and right for them. But people can be on ketamine for quite a while without any negative effects. Like, people can be in ketamine therapy for years. So that would be a conversation more for that individual and their medical history and things like that. But in general, it's a pretty safe drug, which is kind of surprising, because I think when I hear of ketamine before doing ketamine therapy, I feel like I think of it as like a pretty heavy, maybe really risky drug. And not saying that it's not, like, definitely needs medical supervision, but in terms of like dependency and stuff like that, it's not as dangerous as other ones,
And I assume the lowest of low doses are used in therapy. So you're going to have totally different effects in a therapy session versus the traditional like way it was used in the past. Yeah, recreational way. So, okay. Yeah, I really appreciate that.
It's so fascinating because it's even being used to treat like addiction. And so, yeah, it's very interesting. And I don't know all the ins and outs of that, but I do know it's used to treat addiction, which you would think like substance, you know.
You know, it reminds me of healing from an eating disorder. Like you actually have to like use food to heal. And that's the thing that's caused you the most pain. So it's probably a very sticky process, but necessary for some.
Totally.
So I've also been hearing a lot about psilocybin. Sounds really interesting to me too. I don't know a ton about it, but I know it's kind of also a, what is it called?
Psychedelic.
I'm like, psychotic is not correct. A psychedelic drug. With that in mind, you know, we don't have to go into what that is today, but thinking about these trends and how people are using ketamine and psilocybin for therapeutic purposes, what do you see the future looking like as far as treatment for OCD, eating disorders, depression?
Yeah, I mean, I think that like psychedelic therapy is going to become much more mainstream, much more common. I know that some treatment centers are, you know, finding ways to incorporate having ketamine infusions as part of the program that they can offer. So I could see that becoming more mainstream, more common, more covered by insurance. The tricky thing with psilocybin, so it is undergoing trials by the FDA to be approved for therapeutic use. It's a little more complex though, because psilocybin, unlike ketamine, is a plant-derived medicine that comes from indigenous communities, and it's been extracted and whitewashed from the Western world in ways that have caused a lot of harm to indigenous communities. So until there's really talk of repair and implementing ethical practices and right relationship, I think that the use of psilocybin on such a large for-profit scale will probably do more harm than good until those other components are really addressed and tended to. So I hope to see that conversation shifting more towards reparations before it becomes more utilized. And that being said, though, like it absolutely has healing benefits and has been used for a long time. So,
Well, thank you for opening my eyes to that, because I'm not involved in ketamine treatments or psilocybin in a very direct way. So I was not aware that was an issue. And, you know, I'm going to be thinking about it in a different way when I hear about it and listening for those conversations that you mentioned. So thank you for that. So we're going to wrap up now, but I just wanted to ask really quick, do you have any final advice for the people listening? Because you've been so helpful today. And I'm curious where you'd like to, you know, send off our listeners as this conversation ends.
Yeah, I think that this isn't directly related to ketamine, but I just think anyone in recovery, like any major change, I think it really starts with a deep questioning. So if I could encourage any listeners to just question the narratives you've been told about who you are, what your body is for, what aspects of your body are good versus bad, and how that's influenced maybe the way you show up for yourself and others.
I love that. I think questioning is so important, and questioning everything
Seriously
can change your life. So I appreciate that final piece of advice. And Alyson, you have been such a delight to be on the show. I am so grateful for you taking the time today.
Yeah, absolutely. And I'll send you my contact info so you can put it in your show notes for your listeners. But people can also find me on Instagram at bodyjustice.therapist. And yeah, I hope we're in touch more.
Oh, I appreciate that so much. All right, everyone, you heard her. Go follow Alyson on Instagram. And yeah, thanks again. And I will talk to you soon. All right, that concludes this week's episode of the Full and Thriving podcast. Thank you so much for taking the time to listen to this episode of the show. When you have a moment, please head on over to Instagram and follow my recovery coaching account
Meg_McCabe to stay up to date on everything I'm doing in recovery land. And if you're feeling extra inspired, please send me a direct message to let me know how this podcast has impacted your life. I'd love to hear your feedback. Thanks again for listening, and I'll see you next week.